to be doing the Ellacor treatment, and we're going to be doing it for a little bit of acne scarring. Is that correct?
Correct.
Okay. So what motivated you to do the Ellacor?
I just feel like I've tried more mild treatments like microneedling, chemical peels. I just know that you have such a high success rate with the Ellacor, so I just wanted to do a stronger treatment this time.
Yeah, I love that. So with the Ellacor, what it does is it picks out little pieces of skin, and so what we're going to be doing is taking out little pieces of our acne scars with this treatment. So it's going to be a pretty simple thing. Are we doing Pronox on or no Pronox?
Oh, we can. I can get it right.
Yeah, let's do the Pronox if you don't mind.
Yeah, I don't mind.
Yeah, let's do that. Awesome. Yeah, so we'll add the Pronox. So first thing we're going to do is we're going to wipe down all the grease on your face because she's pre-numbed here, and then we're going to start numbing up the skin. And with this treatment, it's really a very, very simple procedure that we're going to do. We always want to clean off the skin after we've numbed it up. We really like to minimize any kind of discomfort that she has.
So I've done microneedling, subcision, chemical peels, and I felt like it was a good starting treatment. It was a little bit more mild, and I'm looking for something more aggressive this time.
Did you do Accutane?
I did do Accutane.
Okay, tell people what you think about Accutane.
So I've always had really bad cystic acne for years. I started coming to Contour and I saw Jessica Arnold, the nurse practitioner, and she recommended that I do Accutane. And I just feel like it changed my skin drastically. I feel like there's no better option for acne besides Accutane.
Right, there are two miracle drugs out there. One of them is Accutane because it really gets rid of your acne and it changes your skin from being irregular, blotchy, pimply, scarry to having perfect skin. It's really, anybody who's out there and is watching this, there's nothing better for acne than Accutane. And if you just suffer from, continuous breakouts, even if with onesies, twosies, I highly recommend the Accutane because it has so few side effects, and it's such a miracle. The only real side effect is that you have to worry about pregnancy. That's the only real side effect that I think is something we see frequently. So now with Myra, we're going to get her a little bit of Pronox to get started. Okay, let me mark you. Again, we have it here first. You can see what we're going to do.
I can get one. I can hold it if you need me to.
Wait, you're not. Okay, so we'll just look here. You want to do this area here then.
What will the Pronox help with, doctor?
This just helps with a little bit of pain.
Was there any other numbing or any?
She pre-treated with a little topical numbing, and then we're going to be doing injectable numbing, and so the Pronox just takes the edge off the injectable numbing. You really don't need it, but what I like to do, especially is because she's on camera, is I want to make sure that she's comfortable while we do this. Now, do you see any other area that bothers you?
Yes, can we add this little area right here?
Right there.
And then I wanted to see if we could add in the smile lines.
It's now really for smile lines. So
okay.
Let's not do that
okay.
because I haven't really experienced how well that works. Why don't we do some subcision today for the smile lines?
Okay.
Because that would be really nice.
Oh, perfect. Thank you.
Yeah, I don't prove that. Okay, so we're going to get started with the Pronox. And with the Pronox, it has the inhalation, which is this one here, and then you exhale through this. So you just want to wrap your lips around this, and you just breathe in and out through that. So just don't take it up there, and just breathe in and out. Do not breathe out of your nose, just breathe in and out there. So now we're going to get started with and you don't have any allergies to medication fatigue. And you started your antibiotics.
Mm-hmm.
So now we're going to start to numb for the treatment. So here we go. And this is the tumescent anesthesia. And what I like to use this for is it helps to numb and constrict blood vessels so it's a little less bloody. And then the other thing is that it tightens up the skin. So, because when you're poking holes, if the skin is taut or tight, it's easier for the machine to poke through the skin and create a nice puncture wound. You can see how easy this is. And Myra, are you comfortable? Thumbs up or thumbs? Yeah, thumbs up. Good. Well. So folks, see it close out here.
Just for this part, what's your discomfort or pain level?
With your fingers. None? She's having none. And that's one nice thing about this treatment. It's really not that painful.
0 out of 10.
0 out of 10. That's the same.
There's blood running down my face.
Yeah.
Typically with this treatment, we're going to recommend 3 sessions. And then after we're done with this, I like to polish it off with a little CO2 laser.
Again, can you remind us what's the downtime for this kind of procedure?
This laser is, or device, excuse me, it's not a laser, it pokes holes. So it's not heating the skin, it's taking little pieces of skin out, which is very different from the lasers that we have. The downtime is going to be typically about 5 days, because then the skin heals over within 5 days. You'll have a little bit of redness, a little bit of bleeding, a little bit of bruising, but after 5 days, you're back to normal. Now, you will have discoloration. The discoloration can last for anywhere from 4 weeks to 6 weeks or a little bit longer. With me, I don't really notice it after 1 to 2 weeks. And for women, it's usually not a big deal because you can wear makeup to conceal it.
I think the concerns on social media, doctor, is about hyperpigmentation. Is that what you're saying, the discoloration?
Yeah, the discoloration. You know, and with that, if you know going into it that it can lead to a little bit of discoloration or hyperpigmentation, you take the appropriate steps to minimize that. And that would be to pre-treat with bleach and retin A, number 1, and then number 2, post-treat with bleach and retin A. And the most important part is to stay out of the sun. Because if you have any, well, let's try to keep that. If you go into it knowing that you can have a little bit of discoloration, you have to stay out of the sun, or it will accentuate that and make it worse. Well, is she bloody on the other side, or is she okay?
Actually, a little bit.
Okay, but not that. Okay, so now this procedure, for those of you who are squeamish, remember that this is a very bloody procedure because we're doing little folds all over the face. So if you're squeamish, you might want to tune out now, fast forward a little bit until we get to the end. But for most people, it's really not that big of a deal. Some people like a little bit of blood. But remember, when we're doing this, there's no discomfort for the patient at all. Okay, so we have the calibrations here. You can see this is set at 5% of the surface area being removed. Now I'm going to bump it up to 8% because I want it to be at the highest amount removed. We can also change the depth the core needles go into the skin, and I want it at the deepest setting so that we can make sure we get the core out in a full piece. Nice and tight without any overlap. Block this.
Is Ellacor the same as microneedling method?
Totally different. With microneedling, you're just poking holes. in the skin. And the idea is it traumatizes the skin, and so it'll simulate new collagen and new elastic fibers. This is actually removing pieces of skin, making the skin tighter, and removing little pieces of the scars. But removing scars where the others is poking holes of scars.
And scars well, this was a question on our Instagram. Will this work on an old scar on the face from a childhood injury, a surgical scar?
I would say with that, I would get an evaluation, because oftentimes the best treatment for a single isolated surgical scar is a scar revision. And it really will depend on what the scar looks like. Is it, first of all, we want to know if it's raised or flat, and you have to just wipe this off. I don't want to see any blood at all. Yeah, just like that. Thank you, doing. Is it raised or flat or depressed? Because depending on that, well, that's a starting point on what we have. Is it, and then we also want to look at the color. Is it white or flesh colored? Is it red, or is it hyperpigmented or darker? And so then, for each one of those things, we can decide. Sometimes the best treatment is a scar that's spread, and that means it's wider than it should be. Oftentimes, we'll just want to cut it out. If it's raised, we'll want to do things like injections with Kenalog or bifluorouracil, or maybe one would want to do a laser to poke holes in the scar tissue so it'll be more pliable and heal a little bit better. If it's got discoloration, we may want to do a laser to get rid of the red. If it's hyperpigmented, we may do a laser to get rid of the darkness. So there are lots of different options for scars. So if you really want to go to somebody who does a lot of scar revisions and scar treatments to figure out what the best treatment for your scar is.
And what about for stretch marks? So like, can I have this done on my stomach?
I've done this on my stomach 3 times. I love this treatment for my stomach. And the reason I did it was I had a little texture irregularity from having liposuction. And it was they didn't do a great job on my stomach. And it helped to shrink and tighten the skin. And I've never felt more confident than when I had that liposuction done like 20 years ago. So I love it for liposuction, for sure. Oh, excuse me, for stretch marks. Excuse me, I love this for stomach and stretch marks.
What other areas have you treated with like Ellacor?
I've done my neck, I've done my face, and when I say I've done this on myself, I've done this on many patients as well. In fact, we're the largest user of this device in the state of California, and we're like the 5th biggest user of it in the nation. I think 5th or 6th, something like that. Now, because I'm against bone here with the skull, I just lowered the depth that I'm penetrating with the shape. Because I don't want it to dull the needles or get up against bone.
Yeah.
And look, this device, one of my PAs learned how to do it if he wanted to, so he does this one as well. So PAs can do this, and it's kind of a fun treatment. Let's have you turn this way in outliner. Like you can kind of hold that up, please.
Does this help with age spots, dark spots?
This is not a device I would put to age spots. You know, with age spots, there's a bunch of different treatment options, but this is not the appropriate one. You can do products, peels, lasers. We have all kinds of great treatments for brown spots. So if you're suffering from that, come and see us, because we can get those brown spots to go away. Myra, you're doing great. Yeah, get all that off there. Thank you. And I want to see those too. If you look right before you see that blood right there? All those little white dots are little pieces of skin that have been removed. Do you see that? Can you see that, Ozzy? What? And you right in here, right in this area there. So, and let's clean off the whole area, please. dermatology? Are you getting into the derm world and you enjoy this stuff?
I'm enjoying it. Yeah, there's a lot to learn.
It's interesting too, right?
You know, during the meeting, it's funny when there was a last presentation. She talked about a lot of people think that dermatology world is just using sunscreen,
Right.
you know, just anything that has to do with a little more so like the face, right?
Right.
It's all cosmetics, right? But there's so many areas.
There's so many things in derm, yeah. Okay, now we're gonna just do those nasolabial folds that she was worried about. I have a little blade here. It's called a Ellacor needle, and it's got a little paddle on it. And what you do is you just put the needle up underneath the skin, and you can see I have it right up underneath the skin. And then I just want to sort of swipe here, like that.
Can you tell us why you do that?
Yeah, this is to sort of soften that wrinkle that we get on this side of our nose, between the lip and the cheek. It's called the nasal nose, nasal, let's go. The cheek, what's it called? Nasal labial fold. So nasal, nose, labial, beside the lip. And so we're just trying to soften that up because she didn't like it.
So this is one of the techniques you do for nasolabial repair.
No, nasolabial repair is if you have a really heavy one where the skin hangs over, then we're gonna just cut out that excess skin. This just breaks up the collagen and stimulates, so it just softens this wrinkle. It's great.
Is there any bruising after that?
You can get a bruise. Anytime you touch the skin, you get a bruise, a scar, discoloration, and infection. Very rarely, but we always have to let people know because you can be that unlucky soul that gets that. Okay, so that's the procedure. In Myra, we're done with this part. How was your little
I felt no pain.
No pain at all?
No
That makes it
pain
so
at all.
easy. So this is how easy it is, and you can see she's a little bit pink, a little bit bloody. And Myra's going to be taking pictures every day, right? To show us how you're doing.
Yes.
This is very exciting. If you have acne scars or if you have wrinkles that you want to improve, Ellacor is really something you should explore and look at.
Thank you, doctor.
Can you also do a card, doctor, where you say thank you for, it's gonna be for Dave.
Okay, yeah. Thank you guys for coming to our Day of Beauty. We appreciate you coming out. Hopefully you save a lot of money on all the goods and services we have on special today. And also make sure while you're here, you get a consultation so we can customize your skin care, so we can customize your skincare treatment plan. Okay. Thank you guys. Okay, thank you, Myra.